Hello and thank you for joining us. It's the largest class action settlement in Canadian history. $40 billion is being given in compensation by the federal government to the survivors and their families who were harmed by the First Nations Child and Family Services program. Half of that money will be used to reform the system from its discriminatory ways. For many, this is justice, and for others, it marks the next step in improving relations between Canada and the Indigenous survivors of colonial practices. It's a historic settlement and moment in Canadian history. Indigenous Services Minister Patty Hajdu says the intentions are well-meaning, and she summed it all up as to how many are feeling.
And I think it really highlights that no amount of compensation can make up for the traumas that First Nations children, families, and communities have experienced. But this will begin the process of healing, and it will support families on that journey of healing.
The settlement is broken down into two elements. Of the $40 billion, $20 is being allocated for the survivors and their families who were removed from their homes between April of 1991 and March of this year. The baseline of compensation starts at $40,000, which can then increase for those who suffered more as a result of the system. Lawyers involved in the litigation are hopeful that the money will be processed and distributed within the calendar year. Anishinaabe Nation Deputy Grand Chief Bobby Narcisse says paying out compensation is a delicate process, and mistakes have been made in the past when providing someone with a large lump sum of money.
We recognize that by introducing this amount of money may be irresponsible and may even cause more trouble or deaths or to people who are in the Child and Family Services system. And so we want to work with the families, we want to work with individuals within the Anishinaabe Nation and leadership, how best to distribute this.
The remaining $20 billion will go towards reforming the discriminatory practices of the First Nations Child and Family Services program over the course of 5 years. Several First Nations organizations were involved in the litigation at the Canadian Human Rights Tribunal, including the Anishinaabe Nation, which acted as an intervener. Narcisse says for the reforming aspect of the settlement, there has to be a NAN-specific component in addition to the input provided by the other First Nation organizations involved.
So NAN has its own specific pathway forward in terms of negotiating with Indigenous Services Canada, with the Crown, in long-term services reform.
Some reforms to the system include funding to support those who age out of the First Nations child welfare system and prevention services to build cultural strengths to help children and their families, which will be implemented as early as April of this year. The number of COVID-related deaths is spiking in the Northwestern Health Unit catchment area, and the number of new cases continues to surge despite the move away from PCR testing for low-risk individuals. There were 126 cases reported Friday, and the NWHU website showed 3 more deaths that day and another one on Thursday, bringing the total of the pandemic to 13. 80 of the new cases were in the Sioux Lookout area, with another 32 in the Kenora Health Hub. Medical Officer of Health Dr. Kit Young-Hoon says the actual numbers are likely even higher due to the less accurate reporting of the system.
At this point, one of the issues we're dealing with is in a large number of cases that come in that have to be manually input into the system. So we may not be capturing all case numbers accurately at this point. And in general, I think it needs to be recognized that case numbers are no longer accurate.
The NWHU currently has 6 cases in hospital. Young-Hoon says going forward, numbers like hospitalizations and ICU admissions will be the information prioritized, as she believes Omicron will bring an increase to both. She also spoke about the Ford government's decision to go back into Step 2 of the provincial framework. Young-Hoon is hopeful the new measures will not be long-term, but she supports the moves until the severity of the Omicron variant can be better understood.
And therefore, it is important to monitor the data in real time and therefore make decisions and pivot appropriately. So to me, at this point, I think that the actions are reasonable considering some of the data trends that are being noted.
It's a crisis that is nearing the tipping point, as almost half the population of Bearskin Lake First Nation have now tested positive for COVID-19. The community has just over 24 staff and volunteers who are uninfected and keep trying to keep those quarantined and supplied and safe. But despite multiple requests for military support, including one from the province, no such help has arrived yet. On December 29th, Bearskin Lake First Nation Chief Lefty Kamena declared a state of emergency in his community. At the time, there were 43 cases. Since then, the situation has spiraled out of control, with almost half of the population of 400 now infected.
We're almost at a breaking point. I think people are exhausted, I guess, emotionally and physically.
There have been multiple requests for military support, including one from Ontario Solicitor General Sylvia Jones to assist the remaining 30 uninfected staff members as they support those in quarantine. Kamena was helping do that himself, but was sidelined when his son tested positive on Monday. New Democrat MP Charlie Angus doesn't understand why the community is still waiting for help.
This is a community that has reached out to the federal government, asked for a week now to have the military come in with logistical support in order to keep people safe. This is a pretty straightforward request.
Earlier this week, Indigenous Services Minister Patty Hajdu confirmed close to $1 million in funding support to deal with the crisis in Bearskin Lake. Anishinaabe Nation Grand Chief Derek Fox calls the situation in his home community unprecedented and is urging the federal government to step up beyond what it has so far.
We acknowledge that the federal government has made funding commitments to Bearskin Lake. Crisis response in remote First Nations, however, is not measured in just dollars and cents. It's not just about submitting proposals and receiving funding. Once again, it's about having people on the ground to help.
While no military assistance has arrived, other communities across the Northwest have come to the aid of Bearskin Lake, with snowmobile convoys from nearby First Nations making 3-hour trips in -30 weather, delivering supplies. Fortunately, the outbreak has not proven fatal and no one has required a medevac out of the community, but there are concerns for what the future holds.
But I think since our elders have been tested positive now and this week, I don't know what to expect now.
Thunder Bay's regional hospital has seen a slight drop in the number of active cases within its confines, and the hospital CEO says they had expected to reopen the dedicated COVID unit when cases began to rise locally. Also, the sprinkler mishap, which led to a number of units being evacuated, is currently being addressed. Corey Nordstrom has more.
One fewer COVID-positive patient is now being reported in Thunder Bay's regional hospital, though the 14 active cases still include 2 in the ICU. The 12-bed dedicated COVID-19 unit is once again up and running in the 3B unit, and an outbreak has been declared in neighboring 3A. CEO Rhonda Crocker-Ellicott couldn't disclose the exact number of patients involved in the outbreak.
The number is still incredibly small. That said, given what we are seeing with Omicron, it's very challenging at times to determine where a patient or a staff could have come across Omicron, given the transmissibility of it. It is contained. We have closed the unit to additional admissions, and we have our isolation precautions in place.
Crocker-Ellicott says there doesn't appear to be transmission with the neighboring COVID unit. The CEO also says they are dealing with staffing issues because of COVID-19. Though not directly related to the outbreak, there were 66 workers off duty isolating as of Wednesday. To address similar issues, the province of Quebec is now allowing some COVID-positive healthcare staff to return to work, but that isn't being looked at locally just yet.
We have not considered returning COVID-positive staff to work. I won't say it wouldn't be something down the road, depending on what the nature of the situation would be, but we have our infection prevention and control experts that guide us through this process, and certainly anything like that would be taken incredibly seriously.
Also at the hospital, an investigation into the cause of flooding in the 2C unit is underway. A sprinkler went off, causing that portion of the building to be evacuated, as well as the unit directly below. The 1C unit saw some seepage into ceiling tiles, which has been remedied, and the rest of the affected areas should be back to normal soon.
That unit, within 24 hours, was able to return all of their patients back to the unit, so that's back intact. There's some small damage that we're continuing to repair, and with respect to 2C, we expect that we will be able to move our patients back to the unit probably by tomorrow or Saturday.
Corey Nordstrom, TBT News.
Cracks are beginning to show in the resiliency of hospitals and long-term care facilities in the region against the Omicron variant. In the Northwestern Health Unit's catchment area, cases of COVID-19 have skyrocketed, And as the 2-year mark of the pandemic nears, staff burnout is beginning to get a grip. Ray Reset is the CEO for the Lake of the Woods District Hospital in Kenora. He says the facility had been able to maintain many of its services in light of staff shortages at a magnitude not seen in the last 2 to 3 decades. But now the balance between the number of staff and the ability to provide quality of care is out of shift.
Getting a big peak at a time where we're tired and the lowest staff that we have been is it really presents a big challenge for us as a hospital, and I think our staff have worked very hard to maintain our services. We do have some beds closed. We have 9 beds closed, and that's because we just don't have the staffing to open them.
On Friday, the hospital announced it would be halting non-emergent and non-urgent surgeries and procedures. Meanwhile, Riverside Healthcare announced in December that it would, in order for it to maintain a level of care to residents at Rainy Crest Long-Term Care in Fort Francis, 42 beds would be left in a state of abeyance or temporary closure, with the hope that those beds would be reopened sometime this year. Thunder Bay's 2 MPPs are sounding off on the Ford government's handling of this latest surge of the pandemic. Tighter restrictions and online learning that were put in place across the province this week. As Jessica Clement reports, both Michael Gravel and Judith Monteith-Farrell say Premier Doug Ford dropped the ball leading up to this point.
While the reaction to the restrictions around the province have been mixed, Thunder Bay Superior North MPP Michael Gravel says he's disappointed with how the Ford government has reacted to the Omicron wave, specifically pertaining to the education system.
Last week, they were telling us the children will be back in schools on January the 3rd, today, on Monday the 3rd. Then it was the 5th, and now it's 2 more weeks. So I do think that's been handled very poorly.
While the government is now taking action with having schools be online for the next 2 weeks, both Gravel and the NDP's Judith Monteith-Farrell believe more precautions should have been taken long before Monday's announcement.
So and I do believe that things could have been put in place so that schools could have been open, could have been proper ventilation put in place, could have been smaller class sizes, could have made sure that N95 masks were available to teachers. So I do think that's the real failing of this government.
We've been asking for a plan to get that in place for now over 2 months, that, vaccinations should have been prioritized for education workers and students, and really making the investment to ensure that kids can go to school.
Along with the concerns regarding the school system, the politicians also want to see more widespread rapid testing for the public in the near future. Monteith-Farrell says that it would bring peace of mind to all residents and hopefully help with the spread of the virus.
People are, going online and Facebook and trying to find a rapid test to be confirmed, and that shouldn't be that way. I really think that people need to feel protected in these times, not like they're on their own, and that's, I think, what this plan has done.
Jessica Clement, TVT News.
When we come back, a mainstay of municipal politics in northwestern Ontario has decided to bid adieu to the role. After almost 40 years, Atikokan Mayor Dennis Brown is calling it a wrap on his career in municipal politics. Brown was first elected in 1980, and aside from a couple of terms out of office, he's always held the position of Reeve, councillor, or mayor. Since then, we caught up with Brown this week to recap his incredible career.
It's time for me to move on.
For 38 years, the name Dennis Brown has been synonymous with municipal government in Atikokan. But for the 2022 municipal election, his name will not be on the ballot. Brown grew up in Devlin and later moved to Atikokan, where he had a career as an educator before first being elected in 1980 to the role of Reeve, which unfortunately was also the time when the small community began to shrink as the result of a loss of a major employer, the Steep Rock Iron Mine, with its population dipping from 7,000 in its heyday to just under 3,000 today.
We lost approximately 1,100 jobs. And that's what was very, very crucial to the town of Atikokan. And you know, since then we've been able to regain some jobs, but nothing like that.
Brown credits some of the town's recovery to Atikokan securing itself as the site of Ontario Power Generation's coal plant in 1985, which was later converted to biomass. He says he wanted to see Atikokan succeed and committed many years towards advocating for industry to come to the community. While serving as both Reeve and mayor, Brown also took on other roles, including 3 terms as president of the Northwestern Ontario Municipal Association.
We wanted to work a lot with, at least I did, with the Northwestern Ontario people, because that helps us community as well.
Part of what drove Brown for the last 4 decades was his love for his community and a belief in a strong quality of life in Atikokan, all while trying to keep the town's debt low. He says he accomplished that by supporting many projects such as the construction of a new town hall, improvements at the sewage treatment plant, and upgrades to the town's arena and pool, all while lobbying for government funding. Most recently, Brown was happy to see Aspen Court, a new supportive seniors complex, open for residents. He says he is thankful for the trust that residents have placed in him over the years.
I enjoy doing it. It gave me something to do after I was retired as a teacher, and my wife left us, in 2012. That was a sad thing too. So I had to be doing something, keep busy, and so this certainly was important. And I thought if I could help the town of Atikokan get better, I'd sure like to do that.
The next municipal election will take place on October 24th. It was voted on and made official on paper last year, and now the signs have officially been changed. Colonization Road no longer exists in Fort Frances. The road signs for the former Colonization Road East and Colonization Road West began coming down and being replaced with Agaming Drive and Sunset Drive signs respectively this week. The initiative to rename the roadways was proposed by Councillor Douglas Judson in late 2020 and was passed by Council in May of last year. Judson says he has seen some of the signs up in town and understands crews might have difficulty working with metal in minus 20-degree weather. He considers this a watershed moment for the community and believes it was one of the most publicly facing files Council has managed this term.
It has been, I think, a further validation that our community was ready for this and wanted this to happen, and sees a more inclusive place for Indigenous identity and Indigenous citizens in the town of Fort Frances. Because when I talk to people who are directly impacted by, the administrative changes that they have to make at the bank or with their driver's license, there's a lot of enthusiasm for it.
Judson admits there's still lots of work to be done to better understand the local history of colonization, to better understand the role systemic racism has played in the region, and to do a better job to lift up Indigenous voices. But he believes Fort Frances is moving in the right direction. A Dryden man has been hit with attempted murder charges stemming from an incident back on September 30th at a Thunder Lake residence. Dryden police had been called to investigate a serious assault. 40-year-old Jack Kelly was charged at that time with 2 counts of assaulting a peace officer, 3 counts of possession of a prohibited firearm, and uttering threats. Further investigation by the OPP has now led to 2 counts of attempted murder being added to the list of indictments. His next court appearance is on January 17th. Coming up after the break, an Oliver Papoonge family makes a go of farming bison. Working a typical full-time 9-to-5 job can be tough enough, but things can get really complicated when you also have a job of looking after a herd of nearly 50 wild bison. That's the challenge for the owners of Stanley Hills Bison Farm. How does one end up becoming a bison farmer? Well, if you're Tim Jansen's, it's very simple.
My wife told me I needed a hobby, and so she said, you can pick anything. I said, well, let's start a farm.
Jansen's was raised on a dairy farm and got his first 2 bison when he was 17 years old, but they quickly ran away. 20 years later, he and his wife Ashley are looking after a herd of nearly 50 animals at their farm just off of Highway 1117. But unlike the dairy farm he grew up on, aside from food and fencing, the bison are relatively low maintenance. But as the sign at the paddock entrance says, do not pet the fluffy cows.
They don't need a barn. They can stay outdoors without a barn. They need a natural windbreak or a windbreak so they can hide from the elements. But other than having 4 hooves in a mouth, there's nothing similar about them compared to a dairy animal.
They're all wild, so we're not going to take the wild out of them. That's very important to keep them the way they are. They're herd animals. Cows and cattle, they're not herd animals, but bison, they need each other, and that's how they thrive.
There are some smaller farms that also raise bison here in the Northwest, but Stanley Hill is the only one in the region recognized by the Ontario Bison Association. The meat from the animals is growing in popularity and has some benefits over traditional beef.
It's a red meat, so if you do like red meat, it's a great alternative to go to, but it actually has a lot of health benefits to it. It's low in cholesterol, it's higher in iron, it's low in calories. So if you want to compare it to chicken, it's lower per ounce in calories than chicken.
This past year, however, has been tough. While the spring started off very nice, the summer drought had a serious impact on both the fields and the animals themselves.
We were feeding our animals our feed for this coming winter, like this winter's feed already in July, just to keep, there was no pasture. The pasture all died off. It looked like someone had burned all the grass off. It was completely dead. There's nothing for the animals to eat. And then also the gains were a lot less on our calves. The cows didn't produce as much milk, so obviously the calf gains were a lot smaller.
Fortunately, Stanley Hill was able to tap into some emergency funding provided by the province this year. And while they were unable to access funding for food, they were able to fence off some new areas to allow the bison to roam and feed off the land. With the partitioned land and some luck, the Jansens are confident they'll be able to stay viable moving forward. Some sad news from the Shoal Lake 39 First Nation and the Treaty 3 Police Service. A young boy who was recently inducted as the force's Junior Chief of Police has passed away. Dion Sidney Green passed away Monday morning. The 12-year-old had battled 3 different forms of cancer during his short life. It was a long-time dream of his to become a police officer like his grandfather. So in October, Dion was given an honorary Junior Chief of Police uniform and badge by Chief Kai Liu at a swearing-in ceremony for new officers. His mother Rachel says despite his terminal illness, Dion wore his badge with pride. He also got a chance last spring to have a virtual chat with his idol, Sidney Crosby. In honor of Dion Green, all Treaty 3 police flags are being flown at half-mast. And that's it for us this week here on Northwest Newsweek. We hope that you enjoyed the program, and we hope to see you next time.